in Missouri with Michael Brown and Eric Gardner and all of the rest. And so there's just a buildup of anger and frustration. And we've actually, during the course of this pandemic, the inequities in our society have been laid bare by the virus and by its disparate impact, the health conditions that exist within communities of color that are a function of social conditions in housing and employment or lack of employment. And the frustrating thing for me, of course, is that the violence in some ways discredits the focus that we all must have and that I've tried to have as an elected official to addressing the underlying inequities that give rise to this problem. I was thinking, remembering when I was a 12-year-old kid growing up in Claymont. My father worked for the old Wilmington Public School District. And I remember him always saying that it was his belief that education at the earliest levels of children was the solution to so many of our social and economic problems that plague so many of the students that were part of his responsibility here in the city of Wilmington. And so when I was privileged enough to be elected governor, that was one of the things that I wanted to address. Was at the top of my list, so to speak, and continues to be. And I have the same frustrations from a different perspective, obviously, about our inability to make as much progress as I would like. But as I think about it in the context of the weekend, and we had peaceful protest in Seaford, in Dover, in Rehoboth last night. The Dover situation was a little bit mixed. I was just kind of felt recommitted to the challenge that we all have to address these inequities and to listen and to try to respond. That's our job as elected officials. In one of the meetings that we had with clergy and with community leaders, there was a lot of discussion about lists that we ought to have as to issues that we should address. And as I had to leave early because of the situation in Dover, I said to those gatherers, I have a list that's like this, and it includes work that we've done together, so many of us, and as we think about, as we move through this period and as we continue to address COVID-19 and as we address some of the underlying inequities that exist in our state, we should be motivated by the fact that if we're going to make progress, we can only do it working together peacefully and through the democratic system that we're privileged to be part of. And so while we have that partially as the backdrop, we also have a very continuing serious issue to deal with in terms of our response to COVID-19. And so I'd like to go through our deck a little bit. We're moving into what we call guidance and guidelines around the next phase. People across our state have been eager to start phase one, which started yesterday. I was on the call with the mayors this morning, and we started off talking about the peaceful and semi-peaceful demonstrations in towns across our state that I mentioned, Dover, Seaford, Rehoboth last night. And at the same time, talking about the conditions on the ground, on the beaches and boardwalk in Sussex County and in towns across our state. And the feedback that I heard was very positive, that we had another good, productive, protective weekend. as we moved into this next phase where our out-of-state quarantine is lifted effective on yesterday, and short-term rentals, and many businesses are turning the lights back on. I went out to get some takeout dinner last night and noticed that in Trolley Square there were a lot of folks that were dining, mostly outdoors. Lots of folks, I would say, made me a little bit nervous, but happy at the same time. That people have turned their lights back on and that we're eager to get underway. And so we're going to talk a little bit about phase 2. We want to give folks enough time to react to it. We have some interim steps. I heard over the weekend as I traveled down to Millsboro for the Memorial Day drive-through salute that I did with General Barry of our Air and Army National Guard. I met with one of my constituents on the motorcycle brigade who was pretty animated about her desire to have her personal care business come back online, and I'm happy to report in this presentation that will be possible on June the 8th in some of these interim measures. So let's walk through the cases. We're almost closing in on 10,000 positive cases. Testing continues to ramp up. Sadly, 373 total deaths, and again, most of them overwhelmingly are in our senior and health compromised population. 4,500 are recovered. We don't hear from quite a few of those folks, and so that's a very soft number. And here we are again, the number that we continue to look at, current hospitalizations, which are now under 160. You may remember we peaked out at about 337, I want to say, about a month ago, and have continually trended down. We'll see that as we get to the overall 3,800 cases in Newcastle County, 1,400 in Kent County, and still there with the most cases is Sussex County at 4,300. Again, the number of cases by age shows the same trend. The bulk of the cases are in that broad middle age category, and still very few cases there among small children and teenagers. Thank God for that. And then a lot of in our vulnerable population over 65. If you look at the dashboard, things continue to look good. In particular, the graph there on the middle of the bottom, I think looks like a textbook peak and decline, Dr. Rattay, which is a good thing. Hospitalizations, again, top left, continuing to go down on a steady line, and including Sussex County, again, where we have the most cases, but as a percent of those cases, I would bet the lowest percentage of hospitalizations. The data dashboard looks good, AJ, in terms of personal protective equipment, and we continue to feel good about everything there. We are hearing from businesses as they reopen the need to acquire protective equipment. Is there anything else that you can share with us on that in that respect?
Starting last week through probably this week, the Division of Small Business has been working to issue reopening kits for small businesses, and they've been distributed to the Chamber of Commerce, the Main Street organizations, as well as state legislatures for them to, and they have hand sanitizer, surface cleaner, face covering for their employees to kind of help them open the doors back up. So that should be a good incentive for them, help them this week and going into phase 2. And as well, we're concentrating on the medical personal protective equipment, not just as we look farther down the road if there's a second spike in the fall, but also we know dentist offices are going to be going back to doing more procedures. You're going to see more people going in for elective surgery. So there's a lot to balance to make sure that the overall healthcare system is kind of in a way prepared for anything that may come in the next 90 to 120 days.
So that's an important part, an important part of our data dashboard, in addition to the The case review, number of positive cases, hospitalizations, et cetera, is the availability of personal protective equipment for essential employees, and those supply lines continue to improve and look pretty good. We do and will have issues going forward, for sure. But here's the information you probably figure out. I need a haircut. Nobody's going to be happier than I am to be able to get back to the woman who cuts my hair, and I'll be able to do that effective June the 8th as we reopen personal care services, hair salons, barbershops, tattoo parlors, et cetera, 30% fire code occupancy, appointment only, which, at least where I go, is the only way you can get it anyway, and with additional guidelines for protections there. And I know there are a lot of folks that both who run these businesses as well as those of us who need haircuts to see those businesses open. And then we're announcing today Phase 2 starting on June the 15th. And essentially, it will mean that those that are at 30% fire code capacity occupancy can move up to 60%, and then lots of details underneath that. With respect to child care, all Delaware families, not just essential employees, can access child care. That's a very critical piece of it, as you would all know. But if you're able to keep your children home, please do so, because we do need to keep smaller group sizes there in these facilities and others as well. Occupancy limit, as I said, 60% of fire code for all facilities and establishments with 30% fire code requirements in Phase 1. So those that are 30% will double to 60%. Applies to all these various venues, restaurants, arts and culture, convention centers, meeting facilities, and the like. Personal care services and gyms remain at 30% fire code occupancy. Both of those, of course, with the what happens there in the gyms and at the personal care facilities is just extra precaution. We will raise the indoor gathering limit to 50 individuals, practicing social distancing with face coverings in public settings when social distancing is not possible. So if social distancing is possible in private settings, it's recommended still, but not required. And so with that, we've got a lot of work to do. We're working through Phase 1 now in day 2. What I've seen on the ground, by and large, has been very positive. We are asking business owners and Delawareans to follow the guidelines, particularly around face coverings when you're in public or in a retail establishment. And workers and businesses doing the same. If we do that, we'll be able to continue to control the virus from spreading, from creating outbreaks in different places in our state. And that's the way we're going to control it. We still are focusing on standing up our expanded testing program, as well as our contact tracing program to control the virus with intense testing, contact tracing, and isolation. So with that, Dr. Rattay?
Great, thank you, Governor. So as the Governor was saying, as we begin to reopen, the guidance that we have been providing all along, and some of it has changed slightly, it remains so important. So staying home when you're sick, washing your hands or hand sanitizing remain very important. But we're going to emphasize a little bit more today and really every day, again, the importance of face covering, so wearing a face covering, especially when you're outside of the home, and staying at least 6 feet apart. So as we go into our new phases, and you'll see in Phase 2, not just guidance around childcare, but also summer camps and summer school kids now are going to start coming back together again. And we see now being a really important time to really emphasize the importance of face coverings for children. Now, when the governor showed, the age breakdown for cases, we have seen all along that our cases look relatively low among children compared to other age groups. However, likely be because children don't tend to have symptoms and so are less likely to be tested. But we do know that children are contributing to the spread of infection. We also know many children, live at home with vulnerable populations. So it is really important that we do all we can to help prevent the spread of COVID-19 between children and among children. Consistent with the Centers for Disease Control and the American Academy of Pediatrics, no face coverings are recommended for children 2 and under. Also consistent with their guidance for kids 2 and up, we do recommend face coverings when feasible. But let me break this down a little bit, because certainly not all children are equal in their ability to wear a face mask. For kids 2 to 4, it's obviously more difficult, especially the younger ones. So our guidance really goes into detail about what is feasible for this age group. But in general, if kids are touching their face a lot, then that's not a good idea for kids in that age group. For kids, though, between the ages of 5 and 12, most kids between the ages of 5 and 12 can wear a face mask or a face covering. So that's a big piece of our recommendation that we want to emphasize today is for kids ages 5 to 12, which is a lot of our kids that are going to come back together now for summer camp and summer school. We want to make sure that those kids are wearing face coverings. And then, of course, for quite some time now, for kids ages 13 and up, wearing face coverings is a part of the requirement. So again, a lot of kids now can and should be wearing face coverings, but for some, it's not appropriate. As I mentioned, for those who are touching their mask or their face or attempting to take it off, especially younger kids between the ages of 2 to 4, consider not using it. Also, for some kids with behavioral conditions, kids with autism, for others, it may make it difficult for them to tolerate face coverings. Kids with asthma, specifically uncontrolled asthma, may make it difficult. So if a parent has any questions about their kids' medical conditions and whether they should wear a face covering, please contact your doctor and talk to them, your healthcare provider. Additionally, some kids with physical limitations, for example, if they can't remove the face covering, also you should consider not using. Additionally, if a face covering itself is a choking hazard, for example, if it has buttons on it, don't use it. Or if it causes any difficulty breathing, or again, kids touching their face more frequently, they shouldn't use them. The more they touch their face, they can increase their risk for contracting COVID-19. They also shouldn't wear it if wearing it causes anxiety or panic attacks, especially if there's a behavioral or developmental or medical condition underlying them. And then, of course, they don't need to and shouldn't wear them during nap time, meal, or snack times. And if they're outside and can be social distanced at all times, then they also don't need to wear it outside. So for some of the younger kids, there's some really good guidance out there that the American Academy of Pediatrics has put together, where kids parents can work with their kids on, looking in the mirror when you both have your face covering on, maybe putting a face covering on a stuffed animal. Let kids pick out their own face coverings or decorate them so that they can be kind of their own face covering. So shifting gears a little bit, as we say all the time, we're learning more and more about this virus on a regular basis, and so some of our guidance evolves as we learn more. including around singing. And you may have seen or heard about some of the risks of singing, but we want to go into this in a little bit more detail. But the sad reality is what we know now, it really isn't safe to sing or yell around others, and that's especially the case if a person's not wearing a face covering. So we've known COVID-19 to be a respiratory infection which spreads through droplets, and often respiratory infections are spread through large droplets that are transmitted when somebody coughs or sneezes. As we've learned more about the asymptomatic spread of this infection, we've also learned more that just breathing and speaking can transmit small droplets. More droplets are produced and spread and even go further when somebody's singing or yelling or just speaking really loudly. And in fact, a CDC article that was published recently from Wuhan, China, was able to demonstrate that these very small airborne particles can travel up to 13 feet. And additionally, they can be suspended in the air for a longer period of time. You may have heard about an event, there's been multiple events, actually super spreader events related to singing, one with a choral group in Washington State, where 45 of the 62 individuals in that choral group became ill. And at that point, stay-at-home orders weren't in effect, but they knew to stay 6 feet away from each other. So they had distance, they didn't have face coverings, but clearly a lot of people became ill, and that was something that really led people to look at the impact of singing. And so we're going to watch a little video that came out of the New England Journal of Medicine. This is looks at the fluoroscopic view of droplets, comparing loud voices to softer voices, and also what happens if you put a mask or a face covering on. So it starts without the mask.
Now I'm recording.
Stay healthy.
And you can see how
Great.
far those droplets
Stay
spread.
healthy.
And he's yelling.
Great. Less loud.
Stay healthy.
And so when his voice is lower, they were actually able to quantify less particles, and they didn't go
Are you
as
recording?
far.
Yeah.
Stay healthy.
Louder.
Stay healthy.
Louder.
Stay healthy.
Nothing.
So even yelling with a face covering on, it prevented the droplets from spreading. I think that's a pretty powerful video to see. And so this is, again, why when singing, yelling, speaking loudly, like when coaches are coaching kids or camp counselors are speaking with kids, those are examples. It really is important to wear face coverings. We also know it's not always available, a face covering, or it might not be. And so you want to at least stay 13 feet away from others. If you are, for example, singing in front of a group without a face covering, also facing away from the audience, or stand behind a physical barrier or partition. But unfortunately, at this time, we are not recommending choral singing or choirs coming together. There's other options, like using recorded music. A song leader can lead others in music, but again, we do recommend a face covering. And if that song leader doesn't want to wear a face covering, again, they need to be at least 13 feet away from other individuals. Also, face shields. Some people will wear face shields instead of face coverings and are more comfortable with presiding over events or activities or singing. So that's an option as well as just a reminder here, when you take your face covering off, for example, if you take it off to sing, make sure you hand sanitize and hand sanitize again once you put it back on. And so with that, I'm going to hand it back to the governor.
So thank you, Dr. Rattay. Really important information and guidance about face coverings, which as we move in and now are in phase one of the reopening, and then as we approach the interim measures this coming week and into phase two, face coverings are going to be an important part of containing those respiratory droplets that you showed on the illustration there, with or without a face covering. And what I see, frankly, is a lot of people wearing face coverings. And I think back a week ago to the beach and boardwalk there in Rehoboth and in Lewis, or just outside Lewis, at Cape Henlopen, the same thing. It's very different than it was 3 months ago, and it needs to continue, particularly as we recirculate more and as we spend time closer to one another, both indoors and outdoors. AJ?
Well, luckily for both of you, I'm not a singer. But I'm going to talk a little bit more about testing today. So I know several weeks ago, we started with Dr. Rattay in our healthcare system in the state, developing the testing plan. We purchased additional tests. We've identified that most of the labs between the hospitals in the private sector as well, the commercial labs, have been able to increase their capacity. So that was kind of like that first milestone we had to pass to be able to speed up a little bit. Then over the last 2 weeks, there's been multiple drive-through events that we've talked about where we are testing anywhere from 500 to 1,000 people in a 4 to 5 hour block. Been very successful. At the same time, I'll say, with the exception of one event, we have not turned people away, so there's still capacity to get more people through those at certain times. And then starting today is kind of when we go to the next layer, and we're taking a little bit more targeted approach. And Division of Public Health, some of their partners and some of the National Guard members are in Wilmington today going through high-rise buildings of vulnerable communities. So these are mostly communities that have older individuals that live with them. They might not be getting out as much. Hopefully they've been making sure they've been engaging in social distancing. But also we understand that maybe they might not be the ones that have the ability to get in a car and go to a site. So between today through the rest of this week, and I believe Monday of next week, we'll be in 10 different high-rise or senior facilities in the city, going door to door with the teams to register people, test them if they want to get tested, and then follow up with those results. Thanks to the City of Wilmington Medical Reserve Corps, which has really stepped up to provide us the muscle that's needed. This is very manpower and womanpower intensive, where you're going door to door. It takes 2 or 3 people from doing the test, checking somebody in, screening them, seeing if they have see if they have any needs that we could assist with, and referring them over to 211 or another social service group is very important. So it was not a small undertaking, but between now and next Monday, 10 buildings will have gone through door to door. And we appreciate the City of Wilmington and some of the partnerships down there to really get into those buildings and help explain to those residents what is going to go on. So as we go through the high rise, we're also going to look at other vulnerable populations that we go through and kind of get down to the micro impact. But let's talk about upcoming test locations. So here is a little updated slide from what we had on Friday. All these events are live to sign up for today at the Curative website that you can get the link from the Division of Public Health's coronavirus.d.gov website. We will be adding more to this in the next few days. We know next week or so on the 8th, first of all, next Monday, we're going to also be at Mission Baptist Church in Dover. So another one of those kind of sub-layer groups that we're going to go out and make sure we engage the community. So in case they can't get to the event we have in Dover tomorrow, we're going to set up in the church and see if we can get a few hundred people there next week. Thursday of next week, we'll be in Frederica, we'll be in Camden, we'll have a few different events, potentially back in Newark with another event next Friday. And then June 10th, I believe we're looking for a location in Georgetown, just trying to finalize those locations. So this is a roadshow. This is just what the state and Newcastle County is facilitating. Bay Health, BB, Christiana Care, Nanacook, all the other hospitals are still actively engaged in testing. They're doing, a few tests a week, depending on what their staffing provides. We have a meeting later on today with them to again look at the next 2 to 3 weeks out to see where they could fill in. But we also know as the hospitals open back up and get a little bit back into their normal routine with those elective surgeries and other functions. We have to make sure we balance what we could take off their plate and how they could assist us. And we use the data that public health provides, looking at where these hotspots may be popping up versus where communities, really down to the zip code or census tract information, do not have the number of tests that they should to tell us some conclusive evidence, and then from there identify where we go. So we have about a week to 14 days out that we look usually to where we're going to go, so keep checking the website, and we encourage everybody to go get tested. And like I said, we have had capacity at every testing site except one where we haven't had to turn people away. So you know, if you go, you know, make sure you let your neighbors know about it and your coworkers, and let's get some more people tested in Delaware.
And so, AJ, what are the protocols now? We testing asymptomatic, symptomatic as well?
So for our test, yes, anybody that shows up and registers could get tested, asymptomatic or symptomatic. Some of the hospitals are still looking for referral, and that's just based on capacity and scheduling. But we believe that for us to really, as we enter through the phases, and Dr. Tate could add on to this, you know, we want to make sure that we are identifying people as early as possible if they are positive, and then it goes into the contact tracing we've talked about, who they've been in communication with or in close proximity with, which would be an exposure, and let's communicate with them to make sure they know they might have a risk to self-monitor and isolate if needed. So it's a layered approach. Not just we have to test, we have to do the contact tracing, and you know, have our hospital systems there to support us as well.
And so when you think about where we've been, where the locations would have been 2 Christiana Care locations here in Newcastle County, Bay Health, 2 locations there, and then the hospital locations in Sussex County. Now, we've got Dover, we've got just outside of Wilmington, another one outside of Bridgeville, Newcastle, Wilmington, Newcastle, Stanton, Newark. So we're really spreading it out.
Yeah, and again, a lot of these, you see a lot here in Newcastle because the county executive, Newcastle County, kind of had a quick execution plan to get a lot of sites up, about 5 a week between this week and next week. So they had that stuff set in stone. Again, we have 2 more in Dover next week, Camden, Frederica as well, that we'll get the links up for. BB is doing one, I believe, this Saturday as well. They're doing another drive-through event. Bay Health is still doing some satellite sites a few days a week. Christiana was out in, I believe, Wilmington again this morning. So their testing opportunities are out there. We have a full testing URL under the de.gov/coronavirus website that shows people by county where these events are. Some you need a reservation for, some you could just show up. And so always more information there that we would prefer people to go to and see what works for them. And at the same time, we don't want somebody to wait till June 10th to get tested if they have symptoms or a concern today. And that's why we don't, you know, we're trying to do the road show, but we also don't want to show our schedule too far out because we want them to get tested as soon as possible, not wait until something's right across the street from them.
And so when we talk about the new normal is this kind of testing.
Yes.
There will be testing obviously available through our hospital partners, which have been tremendous since the beginning and continue to be. But increasingly, you're going to see outreach like this, testing opportunity coming to a school, an elementary school near you, or a park, or a public facility, maybe a place of worship, those kinds of things. And we do need to encourage folks to get tested because that's the way we're going to control the virus, right? We're going to have protective measures like mask wearing. We're going to have protective measures by testing, isolating those who test positive, and then tracing their contacts so that we can test them and isolate them as necessary. People ask me all the time, what are you going to do if you see a spike? Well, I think every state is working through that, but this is essentially the way we're going to address and protect the public and prevent the spread going forward through this extensive testing, isolating, and contact tracing. So we're in this together. As I think about where I started, talking about the challenge that we face with the anger and frustration over the George Floyd murder and the circumstances around that, the social inequities underneath. When a week and a half ago, when I reflected on generations past, as we headed into Memorial Day, I talked about the challenge of our time and our generation. This is it. We've got a pandemic that has laid bare inequities. We've got another killing of a black man by law enforcement that shows again this persistent history of those relationships between law enforcement and black communities. We've got to address both at the same time. And the only way to do it is if we do it together. We do it peacefully but challenging each other. Nobody hesitates to challenge me as governor, and I welcome that. I have a long list, as I told the group the other day, and the top of that list is education from the early years of every child through high school graduation and on to higher education. We can do it, and we'll do it working together. So with that, I invite any questions that we have, and Meredith is with us.
Hello. The guidance that you all put out on singing is really behavior you would see at a protest. And I'm wondering, with more protests expected in Wilmington and throughout the state, is there a concern that these could be public health risks regarding coronavirus? And will the state put out any guidance for those who want to protest but also do it safely?
Yeah, and I'll turn it over to Dr. Rattay, but the guidance is the same, and we respect the right to protest and protect that right peacefully. But people ought to be conscious of the need to be safe in terms of face coverings as well as social distancing. Hard to do, and as we heard the shouting, so it works a lot better with the face covering.
Yeah, that's exactly right. I mean, when the virus is spread from person to person, and so one of our concerns about crowds or large amounts of people coming together is the spread, and the more people, the more potential there is for more people to become infected. So face mask, face covering wearing, and social distancing is really, really important in these settings. But as we saw from the video, a face covering can really do a lot to stop the the dispersion of these droplets. So a face covering can make all the difference, whether whether somebody is inside or outside, but especially in a crowded situation like a protest.
And CMS released data on Monday regarding nursing homes, and it included data for Delaware regarding number of healthcare workers in nursing homes who have been infected and died. For Delaware, it was 168 healthcare workers infected with the virus and 2 deaths. People already have said that these numbers are underreporting, and they expect it to be much higher in reality. I'm curious if you all can comment on these figures, if you think that they're accurate, and if the state will release this data since it is being released at a federal level.
Yeah, so I don't know, I can't comment on the numbers themselves, but what it does underscore is the need to protect both the workers and the residents. And the residents get the virus through the workers. And that's why we've talked about our challenge of testing, requiring testing among workers, and we'll continue to work through that, and testing among residents, which I understand we can't force, but we're going to try to do as much as we can, and it'd be everybody's interest to do that. But you can't, excuse me, you've got to, my understanding is you've got to do it by protecting and screening the workers.
But will the state release the data about healthcare workers?
I don't know the answer to that.
Yeah, so great question. We have been really enhancing our data collection through our case investigation work over the last 6-7 weeks or so. That 2 deaths that you mentioned, it's possible that that's underreporting because we and others, those data may not reflect all individuals who are healthcare workers, specifically in long-term care settings, who have passed from COVID-19. But absolutely, we're happy we've brought on a couple new data analysts over the last couple of weeks, and it really is important for us to look at our data and get it out there for the public to see what is happening. I can say, among healthcare workers and especially those in long-term care, many of those employees, many of those staff are among the vulnerable population. And so, as Governor was saying, again, it's, protective measures are really important, but also routine testing is also an important part of the strategy going forward.
And just in terms of, so I understand the logistics of how this information is reported to CMS, do the nursing homes report directly to CMS, or does that data come through Delaware to CMS? I'm just confused why the state wouldn't have that data readily available, but the federal government would.
So there is some reporting that does go directly to CMS from the long-term care facilities. But we do have a systematic way now of collecting that information through every case investigation, whereas early on that question wasn't asked of every case. So it's data looking at it from two different data sets, if you will.
Mallory Metzner at WRDE asked, do people have to wear face coverings when exercising?
I know that's been an issue of some concern, and my recollection is it depends.
Yeah, it depends. So for a lot of people, it's not super comfortable to wear a face covering if you're running, the more aerobic the exercise is. And so if you are outdoors and especially 6 feet away from others, it's very unlikely you're going to spread COVID-19 to someone else if you're social distanced, and you briefly pass somebody on a trail. Biking would be the same thing. So outdoors is less concerning. Some of our concerns come around, people now are working out in gyms, right? Gyms are indoors, so that's a riskier situation. I was just speaking with a friend who is over 60 and wants to go back into the gym, and so, I'm suggesting if you can tolerate a face covering, then you should if you're in a gym. It's in other sports, and kids who, come less than 6 feet away from each other in their sport, and we're starting to really look at, can kids wear face coverings safely so that they can go back to some of these sports. So again, it does depend. It's always going to be the safest thing to do, but we know that especially with high aerobic activity, it may not be quite as comfortable.
Next question's from Matt Biddle at the Delaware State News. It's kind of in line with what Meredith was asking about concerns potentially with the protests and spreading the virus. Is there any evidence linking the spread from past protests, such as the May 1st rally on the Mall in Dover?
I am not aware of any infection spread from any Delaware protest, but again, it is a concern if people aren't wearing a face covering and if they are not social distanced. Certainly it is a concern that people will spread between one another.
Jacob Owens at the Delaware Business Times asks, what concerns have you been hearing from the state's largest employers in preparation for reopening their offices, and where is the state in regard to testing for employers?
Yeah, so I'll have let AJ deal with the testing, but that's one of the questions that we've received from employers, and that is, will the state make testing available for our employees? We want to test our employees. It tends to be the larger employers who want to do that. How can we do that? We want to obviously share the information confidentially so that we have some sense as to where there is spread and not, and do the contact tracing part of that. I think we're still working through a lot of that. The University of Delaware in particular is thinking around, how do you bring students back? Do you test faculty and students? They're both an employer and an educational institution, so fairly unique in that respect. We still are encouraging businesses, if their people can work remotely, to do so. But the thing that in addition to those businesses who are closed, who wanted to open sooner, I can't overlook those businesses because they really have taken the brunt of this thing. You know, they've wanted to open sooner. They are very, and I'm talking about restaurants, bars, I mentioned the personal services, they're very focused on protecting their customers because I think their customers understand the risks as well. And I think they're more focused on that, and the message to us is, we can do it, let us do it. And then for the larger employers, I think, how can we help?
No, so I think there's a few things there. And if you remember last week, Dr. Atay released the guidance for businesses for testing. So we really have to look at where is the risk, what professions have a higher level of risk. For the other employers that want to test people, it's what's the mechanism. Right now, as they are slowly reoccupying their offices maybe, we are trying to get our testing sites out there, and they're, as the governor said, they're open to anybody. What we want to drill down with as we go through this layered approach, after we get through some more of the vulnerable communities, is where are these high-risk professions that need to have testing on a regular basis. So there's one thing to get a test done to get somebody back to work, but then there's a frequency that Dr. Atay spoke to last week, where some industries people should probably be tested every 2 weeks or every week. Others, it depends on their exposures, and they have to self-monitor themselves and look at other characteristics. So we are working with the Division of Small Business to see what the appetite is out there. I think it is something that we have to also tackle with our healthcare partners to make sure that, for an easy way to put it, if you have a large employer and they're paying a lot of money to insurance each year, what can we do to bring those healthcare provider in there to do the testing and then have the insurance company pay for it? The state's not going to be able to pay for every COVID test that we do. We want to make sure we get to the communities, to get the vulnerable communities, the testing, the uninsured testing, but we're going to need help. I mean, we don't, to do 80,000 people a month is going to take more than just what the Division of Public Health has.
Doug Rainey at the Delaware Business Now asks, were you on the controversial call with President Trump yesterday? And if so, what is your reaction to it?
Yeah, I was kind of stunned, frankly, by it. It was intended to be our weekly call with the COVID-19 White House Task Force, which is usually run by the Vice President. And the President went on right away and ripped into the governors pretty hard about what the decisions they were making for protective measures on the streets of their various states. And I just thought that it wasn't what we needed at the national level at that juncture. We needed somebody that would show more support for the states and the very difficult decisions that governors and local officials need to make. They're looking for a leader who is going to try to tone things down and take some of the steam out and get everybody to be calm and relax, as opposed to language that seems to add heat to the situation. So it was not many governors responded. Usually there are a lot of governors who chime in. There were a couple that mentioned certain challenges that they had around the social unrest and the use of National Guard, but it was a pretty quiet call on the governor's side.
From the Delaware Public Media, Wilmington has a painful history of National Guard occupation following protests over the death of Dr. Martin Luther King Jr. Under what circumstances would you allow the National Guard to get involved in Delaware if protests here were to continue?
Well, first of all, I need to thank Mayor Perzicki and Chief Tracy and their team for the way they conducted themselves on the street there on Saturday and under very stressful conditions, the objective of which was to protect property and folks from injury. And I think obviously there were mixed results with respect to the property side, and on the people side, not many people were hurt. I don't know the exact numbers there, but they have a very difficult job, and part of their job is not to make it worse. And I think that's the challenge that local officials face, is to how to calm a crowd down that doesn't explode into violence and vandalism. And there are people that are going to be there looking for that, and that's understood. And when you're being pelted by rocks and folks are throwing stuff at you, and how do you maintain appropriate control, and where is that line? You know, when people cross the line, it's a difficult decision for any law enforcement officer or leader to make, and we can all second guess that. It's not really constructive. I think what's constructive is to try to lower the temperature, to get people to come together, to focus on the issues as opposed to, and channel some of the anger and frustration into positive energy, working together. I was very pleased with the reports that I got from the mayors on the call today. And one of the reports that I heard yesterday was the Dover incident stop, basically when Colonel Nate McQueen grabbed the megaphone and spoke to the protesters that were assembled out in front on Route 13 in front of the headquarters, and basically told them that he respected their right to protest, but they needed to do it peacefully, and it was time to go home, and eventually they just dispersed. Very impressive.
Amy Cherry at WDEL asks, do you believe out-of-state rioters played a role in the violence that was seen in Wilmington Saturday night? And if so, what evidence do you have?
Yeah, so I've heard a lot of reports about that, and my frustration really is, the point there really is that, you know, to engage so many people that have really good intentions with respect to the peaceful protest, and then have people that maybe aren't from here or don't have the best interests of our city and our state uppermost in their mind, whether they're from in-state or out-of-state, to be instigating destruction. Just very frustrating for me as governor. My focus is, and I think all the leaders that have been engaged in this, the focus is on listening and trying to address the real issues that underline the anger and frustration. And that's our challenge, I think, going forward. First, obviously, to keep calm and to protect persons and property, and hopefully to avoid another situation like that. But secondly, to address the underlying grievances that are real, that are historic, that are ones that are hard to address. I mentioned education at the front, and if there is something more important, I don't know what it is. Obviously, the engagements between people, communities of color and law enforcement is up there too. But if we're going to be the state and the country that we need to be, and we all want for one another, then that's what we're going to have to do. And so it's just frustrating to me when I see people that don't care about that.
Another question from the Delaware Public Media. Will the state consider some sort of assistance to small businesses that were damaged during the protests?
Yeah, so we do have assistance for small businesses that are part of COVID-19 response. There has been a lot of discussion about how can we extend that. And so we'll be looking at ways to do that. We do have limited resources. COVID-19 resources can only be used for COVID-19 response purposes. But we'll be looking at all kinds of ways as we reopen to kind of re-energize our economic base here. And I had another phone call today with Business Roundtable and the State Chamber and other chambers, just to, with an update on all the various issues that we're dealing with. And, my request of them was help us, identify those things that will help you re-engage, go back, bring your people back to work safely. We will help you with that and get our economy rolling again.
Sir, if I
Sure.
may add that. So
Yeah, please, AJ.
The other thing with that is we're working with City of Wilmington and Newcastle County right now to get a little bit more understanding of the amount of damage that was done and to see what federal programs and what we're hoping, we're able to have the argument to articulate and have a letter go to the governor up to the Small Business Administration to see if we get a disaster declaration from Saturday for those small businesses. I think the numbers are going to be a little low, but we're going to put together the metrics we can and put it up there to see if we get a little bit better help. I mean, we were 2 days before phase one, and there's businesses that are just getting ready to reopen. So I think we're going through every due diligence process we can to see what we could do to provide for the city of Wilmington.
Across the country, we've seen reports of reporters and members of the media being assaulted, even detained, trying to cover these protests, some of them violently. The last question for today is from Sean Green, who was actually assaulted Saturday night in Wilmington in the course of reporting on the riot there. What sort of messages, Governor, did you hear and see during the events of Saturday in Wilmington and Sunday in Dover? And what are your plans to address what you saw and heard?
Yeah, so there's a lot there, and there wasn't, with respect to the protests themselves, what I saw was anger and frustration over the lack of progress over years. And I think the anger and frustration, particularly of young people, that they're coming up in a world that continues to have those problems and those challenges. My focus, and I think the focus of most, and so many of the people that we've engaged with, first is to listen, like really listen, and try to identify that list. You know, I talk to legislators and other elected officials all the time about things that we need to do, and that comes from the people that they represent. And it contains a list of things to address the underlying problems and concerns there. And so for me, I have a list. It's been a list that I put out there when I first ran for office, 20 years ago. When I ran for governor 3.5 years ago. I'll continue to work on this. It was a list that frankly brought me to public service in the first instance, kind of inspired by that, what my father said to me about education and its importance in social progress and addressing some of these inequalities that we talk about. And so that's going to be my focus as governor. First is to make sure people are safe and secure, that we don't have a violence that gets out of control. That's our number one priority as public officials, to engage, to listen, to serve. It's and to be the voice of calm and a voice of conciliation and a voice that attempts to bring people together. I think that's how we're going to be effective in fighting COVID-19 going forward. We need to recognize that we're all neighbors, that we're in this together, that what we do affects our neighbor, and what they do affects us. We got to be smart. I mean, if people settle and think about how do you do these things, it's by engaging, it's by working together. And it's also by pushing, people, particularly younger folks, want something to happen now, and I understand that and appreciate that. And with that sense of urgency, we need to act. So with that, thank you again for joining us today. Please be safe, and we'll see you later in the week.